So what I want to do today is give you kind of a high level overview of just some basic knowledge to make sure that when we're talking about dementia or Alzheimer's, we all are using the words in common, and then also some of the resources, especially because in our remote and frontier areas, it can be very difficult to find resources when you need them. So hopefully today I can give you some that you can use without needing to drive to Williston or Billings to get the help that you need when you need it. So I want to introduce you to my mom. Wrong screen. She was actually an English teacher at Plentywood High School for a couple years before she had me, but this was Mom and I in San Francisco in 2015. This is when Mom started noticing some memory issues, but it was also very hard for her to admit that. She'd always been fiercely independent. She was proud of her intellect and her academia. So although she knew something was going on, she also didn't want to admit it. Excuse me, sorry. So we went to San Francisco to have some brain scans done. And of course, back then, diagnosis was still pretty barbaric as it is now, but they told her she was 10 years away from having the first signs of Alzheimer's disease. And so we fast forward to this last winter, 9 years later, and my mom passed for, February 4th due to a dementia. We didn't ever determine what type it was because that's very difficult in Montana. It is actually difficult most places. But I think I do this work because she so desperately wanted answers and wanted to know what was going on. And yet it didn't feel like there was anything. And so I want to be there for other people going through this to at least provide support and let them know they're not alone. Because for both Mom and I, it was an incredibly lonely journey, not sure where to reach out, not sure who was there. I didn't know about the Alzheimer's Association. I was a teacher at the time and following my own kids and their activities. So it was a struggle at best from day to day. And so now, knowing what I know, I just want to make sure that I can be there for other people on this journey. So our mission at the Alzheimer's Association, even though we're a state chapter, we belong to a national organization or association. And our mission is to accelerate global research. I just returned from Philadelphia, where I was at a week-long research conference with over 8,000 researchers. And the science and the research that's coming out right now on this disease is incredible. They say it's equivalent to cancer in the 1960s. The momentum is real. You can feel the energy when you're walking down the aisles listening to the scientists talk. And what they're finding is it's very powerful. And hopefully we're getting closer and closer to a cure. We do have some treatments on the horizon. We just don't have a cure yet. And I'll talk about that a little bit later. If you look at our symbol, that purple squirrely sign, it actually represents bringing the person's mind or their brain together with science. So although our scientists are working frantically and scientists all over the world are doing research, our goal in the chapters is to really be there for the people impacted by the disease. So whether they're the person living with dementia or the caregiver, we want to be there to support. So we do several things in care and support. Like I'm doing today, providing resources, talking about what's available. Advocacy, if anybody's ever interested in advocacy, we do work with our state legislature and also our congressman in Washington, D.C. to really try to get more financial support for research and for caregivers. As you probably are all well aware, caregiving for somebody with dementia is very expensive. In fact, it is the most expensive form of caregiving out of any caregivers. And so we're really working with our congressman and our state legislature to try to get more support in place for people caregiving for somebody with dementia or living with it. I do a lot of education and awareness. Today would be considered an awareness program. I'm just letting you know what we have, but we also have quite a few education programs, and I'll be talking a little bit about those later on. I mentioned the research that's happening. Not only is it happening worldwide, but McLaughlin Research Institute in Great Falls just received a huge NIH grant, and they are using their mice right now, but also moving into some clinical studies. And then there is a PhD student or professor at MSU that's doing some research right now on relationships and cognitive reserve. So what we're finding in all the research is that lifestyle has as much of an impact on Alzheimer's and dementia as treatments and medications. So we're really taking a close look at lifestyle. And that's what her research was based on, is how do relationships help us with our cognitive reserve, and in the long run, hopefully prolong the development or delay the development of dementia. And then diversity, equity, and inclusion. We're working more with our diverse populations in Montana, but at this time, Montana is all considered underserved since we're so rural and frontier in many places. And so our whole state is considered an underserved community since we don't have access to some of the latest treatments and diagnostic equipment. So Alzheimer's is a brain disease that affects memory, thinking, and behavior. I so often, when I first start talking to people, hear them say, "Oh, I just told them that answer a minute ago. They already forgot. Why can't they remember what I just told them?" And so I think it's always important when we're talking with caregivers or people impacted by this disease to remind them it is a brain disease. This person isn't doing this to you on purpose. They're not trying to be belligerent. They're not trying to be stubborn. Their brain really can't keep track anymore. It's actually cellular death and neurological death in the brain that's causing these gaps in the brain so that the messages can't be passed through the brain. So it will interfere with their daily tasks, including not remembering they just asked you a question. It is a progressive disease, and this is just Alzheimer's. Like you were saying, with some of the other dementias, they don't progress quite like Alzheimer's does. So they say once you know one person with dementia, you know one person with dementia because everybody's very different. But for the most part, Alzheimer's will progress in most people, and the other dementias will progress, but maybe at a different rate or with a different trajectory. In the early stages, most people are still able to function fairly well, fairly independently. They might just need more reminders. They might need people checking in, making sure they're taking care of taking their medications, making sure they're eating. I would check. My mom used to live in Helena, and I would go by her house to check to make sure she was eating. Towards the end, before we had to move her into a facility, I noticed that her dinner would still be sitting in the microwave. And so I'd say, "Hey, Mom, your dinner is still in the microwave." And she'd say, "Oh, that's where it is." Totally forgot that she hadn't eaten. So they can probably function for the most part, but they'll need reminders of things that they need to do. And then as the disease progresses, they need more and more around the clock care. Before my mom passed in February, I went and spent about a week with her. She had broken her hip, and as you all know, that that just doesn't go well with people with dementia. And at that point, I couldn't even leave the room to go to the restroom without her forgetting that I had just been there and told her to sit and wait till I got back. So I actually had to get one of those dementia robotic cats to put on her lap so she wouldn't try to stand up when I left, because she would forget that she wasn't supposed to stand up and forget that I was there even and would be back in the room in a moment. So it definitely progresses and changes as the disease progresses. A lot of people use Alzheimer's and dementia interchangeably, and there is a reason for that. Dementia is the overall term that we use to describe a syndrome or the symptoms that we see in people with cognitive degeneration or cognitive loss. Alzheimer's happens to be the most common type or form, affecting about 60 to 80% of the people living with dementia. So there's a good reason that we use it interchangeably. Other types of dementia are vascular, Lewy body, frontotemporal, Huntington's, Parkinson's. The thing that's hard with dementia is that most people are living with more than one form. We have a volunteer in Butte, and her brother agreed to an autopsy. And when they received the results, they actually found evidence of 3 different types of dementia. So that makes diagnosis a little bit more difficult. And that's why everybody looks so different that's living with dementia, because it could be a combination of several types of dementia. So not everybody's looks the same or is the same. These are the hallmarks of Alzheimer's. So when you hear people talk about the plaques and tangles, or the beta amyloid and tau, that is the hallmarks of Alzheimer's, not the other dementias. Right now, there's a lot of research looking into the plaques and tangles and what impact they have. We still have more questions than answers. One being, we're not sure if these really cause Alzheimer's or if they're like a symptom. Something else is happening and these are a symptom of it. For example, people with Down syndrome, at 40 years old, generally will develop these hallmarks, but not all of them develop Alzheimer's. So people have been known to live with plaques and tangles and never develop symptoms of Alzheimer's. But they are finding in the current treatments that by removing these, people are able to stop the progression of the disease. So the new treatments that are available right now, there are two, remove either the plaques or the tangles, and then they see the progression of the disease either slow or completely stop. We can't yet reverse it though, so that's why it's very important for people to get an early diagnosis. The brain on the far right shows two different sides. The left side, of course, is the healthy brain, nice and robust and full. The right side is advanced Alzheimer's. And so when I'm talking to people about why their loved one can't remember what they just said, can't remember if they ate or not, can't remember names. If you look at that brain on the right, it's just, almost half of what a robust brain is. And so that's why they're not able to make connections and to carry on a conversation and to remember things you just talked about. There's a huge impact on women, especially in the United States. Not only are women more likely to develop the disease, but we're also more likely to become caregivers. And more often than not, adult daughters are more likely to become caregivers, putting them in that sandwich generation where they're maybe raising their own kids and then also caring for a parent. They're looking into why that might be. One idea was that women live longer, but they're also now looking at some of the hormonal changes that women go through to see if that might be having an impact. There are 7 million, almost 7 million Americans living with dementia. There's about 21,000 in Montana. I'll show you that slide next and talk a little bit more about that detail. Our minority groups are more likely to develop dementia and Alzheimer's. It does kill more than breast cancer and prostate cancer combined. But again, we went through that surge where we were able to treat cancers. And now we're going hopefully through the surge where we'll learn how to treat Alzheimer's and other dementias. And it might look similar to cancer where it's actually kind of a cocktail approach to help people with their dementia and to treat the dementia. Heart disease has decreased by 2.1%. or deaths from heart disease, but deaths from Alzheimer's have increased by 141%. So as people age, which is the highest risk, we're finding they're developing the disease. And that's why we're seeing more loss to the disease, because people are living longer and we're able to manage the other diseases better. 1 in 3 seniors will die with dementia. Alzheimer's are a form of dementia. Here are the Montana statistics, and I apologize, this form is so hard to read. I can send you one if you like. But what really astonishes me is 21,000 people in Montana are living with dementia. I think that's an underestimated number. I think there's still a stigma around it in Montana, and many people aren't willing to admit or, say that they have dementia. I think we probably have a lot more than that because we do have a much older population. But aside from that, only 17,000 people see themselves as caregivers. So I also think we have a little bit of a stigma in Montana where people don't either see themselves in the role of a caregiver or don't recognize that they're a caregiver. And because of that, sometimes their health can decline quickly. For example, caregivers with depression is at 22.8%. That might be due in large part to the social isolation, the trying to manage and keep up with everything 24/7. But also caregivers with their own chronic health conditions is at 56.9%. So almost 57% of caregivers are trying to manage their own chronic disease. So our mission is also to support them because we know that their health is also very important. And we need to be cognizant and caring for them too on this journey. I already mentioned that age is the #1 risk factor. As we get older, we run a higher risk. Family history. There's some of that is lifestyle. So if you eat and act and socialize and do everything you were raised to do with very similar lifestyles as your parents, and they had dementia, or one had dementia, it could be that there's something in the lifestyle will put you more at risk for it. Beyond that, there is a part that genetics play. There is a gene that is a deterministic gene that means you absolutely will get Alzheimer's, but it is actually a very, very small number of people that have that gene. And it's usually they'll develop dementia before the age of 65. It's an early onset. The other genes are called deterministic genes. It's an APOE4 gene, and it means, or it's a risk gene, sorry. What that means is you're more at risk, but what we're finding is through lifestyle changes, you can actually decrease your chances of developing dementia or delay the onset by 40% through lifestyle change. So I always tell people that's the best form of treatment without side effects, and it's something that's accessible to everybody. So it's the same thing we know is good for your heart. Keep your head protected, wear your bike helmet or whatever it might be. Keep your diabetes in check, keep your blood sugar low, exercise, eat right, eat whole foods, socialize, and challenge your brain. Not just doing word puzzles every day, but make sure that you're doing things that actually kind of hurt your brain, where you're having to reach that level that your brain's frustrated, because that means it's working and it's learning new things. It's like a muscle. Women are more likely than men to develop it. If you've had a head injury or maybe have smoked a lot or not managed diabetes, those things will also put you at higher risk for developing Alzheimer's. I think we talked a little bit about this already. There are some things we can control that will help us manage dementia or prevent it or decrease our chance of developing it. There are some things we have no control over. So we really want to do something with those things that we can control to keep it at bay or delay it. There is new research that is showing that the biological changes of Alzheimer's might start happening 20 years before anybody starts to see symptoms. So if we could tap into that and find out when those changes are happening and pick up on that, that might help us with some of the treatments. From there, people might go into what we call MCI. That's mild cognitive impairment. Not everybody that has MCI will develop dementia. Some people are diagnosed with MCI and might live with MCI for 15 or 20 years. That just means they probably need help with remembering things, might need some help problem solving, but for the most part, they can probably live independently as long as they have a little circle of friends or family that are checking in on them. If it does develop into an Alzheimer's, then we start talking about the mild, moderate, and severe stages. In the early stages, again, they might be able to live fairly independently. As they move through the stages, though, they'll need more and more care. So our goal with our lifestyle changes and with the prevention things that we're learning about is to keep them in the earlier stages longer, because right now most people live in the late stages for the longest amount of time. So if we can prolong that and start, talking about healthy habits for our brain, maybe they won't progress as quickly into that late stage, and they will be able to go to basketball games and go to birthday parties and go to family dinners, and for the most part still function in those earlier stages rather than progressing as quickly. An early diagnosis, we're really promoting that, and it's a tough sell in Montana, but we so strongly believe in that. For one thing, they could enter a trial. There's so many trials going on right now. And so somebody could qualify for a trial for a new medication or treatment. It also allows them to have conversations with their doctor, with their loved one, with their family about what they want their care to look for, what's important to them, what are some things they want to make sure are done during their lifetime, and just start having those conversations. We do have a whole program called Managing Money, which helps caregivers and those living with dementia walk through some of the conversations that you might need to have in the early stages. And you can enjoy this time too. I always say there's moments of joy in every stage. With my mom, they changed with every stage she went through, but it's always about looking for those and finding those. And Joan, you were talking earlier about the things you enjoy doing with your mom, playing aggravation and things like that. You can almost always find joy in each stage. And it's also about embracing that and the acceptance part of it and knowing, okay, this is our new life. It's not what we thought. It's not what we expected, but here we go. There's more emotional and social benefits. We do have some early stage memory cafes around the state. I know Roundup has one, Havre has one. It's just a time for those living with dementia and their loved one to come together. They might do a little activity for about half an hour or 45 minutes and then have coffee and visit. It's a safe environment where they can get together with other people on the same journey and not feel like, it just is a little less stressful because everybody's in the same boat in these memory cafes. and a time to plan end-of-life decisions. If we had listened to my mom at the end and what her wishes were, it would have been nothing like what she told us when she was more cognizant. So I'm glad we had those conversations early, because at the end, she was 80, but she was telling us she wanted to live to be 100, and, it was nothing like what she had told us when she was 65. And then there's also a lot of financial benefit. This is a very, very costly disease. It's costing Americans billions of dollars to care for those living with this disease. And so through early planning, people can be better prepared for some of the costs associated with it, or find resources that can help. Maybe they do qualify for some physical therapy or some occupational therapy in the home, or a social worker to come in and do some interventions in the home to make it a place that the person living with dementia can stay longer, but with a little less stress. For example, we know that eliminating clutter is very helpful for those living with dementia. So even something as simple as helping somebody downsize their home, taking out rugs, things like that, that might eliminate some stressors for the person living with the disease, can make less stress for everybody. Right now in Montana, we don't have a way to diagnose. I think in Plentywood, I know there's a lot of people that go to Williston, because I hear a lot of, or I get a lot of referrals from Williston, but I don't think they can diagnose there either. The PET scan that's required to diagnose for Alzheimer's, the isotope, has a very, very short shelf life. It's only 2 hours, so it can't make it to Montana in time. So our doctors use a lot of these they do a physical exam. They might listen to family members, keeping a memory journal, bringing examples to the doctor to talk about what's happening will help. But sometimes it's just an answer. With my mom, we thought it was type 1 diabetes that was causing all these memory issues. And the more I tried to control her diabetes, it seemed like the worse it got. Well, then when I found out it was dementia, I was like, oh, that makes way more sense than diabetes. So I think sometimes it's just an answer for the families. They know what they're dealing with, and they're not running around thinking it's something else. Or it could be something else. It could be a medication. It could be a UTI. It could be a number of other things too that could be reversed if the proper diagnosis is put in place. We are very close to getting a blood test. There was one just presented last week at AAIC that's 90% accurate in picking up the hallmarks of Alzheimer's. So imagine how that's going to change the landscape in Montana if you can go in and get a blood test that will determine if you have Alzheimer's or not. This is the impact on families and on caregivers. We know that the physical, emotional, social, and financial toll is extreme. So we also want to be there for caregivers and to make sure that we're lifting them up, helping them out, giving them resources. I've mentioned that most caregivers are women and adult daughters. 70% of the cost accrued by dementia is borne by families. So again, the financial toll is significant. And then many of them just indicate, like the depression I was talking about earlier, and the stress of caring for somebody with dementia. These are some approved therapies right now. I won't go into a ton of detail on this slide, but all of these in yellow just work with the symptoms. So if somebody's put on Aricept, that's just working with the symptoms. But as you can see with this graphic on the left, they only work in the middle stages of the disease. So I know as people progress, the family thinks, oh my goodness, can't you give them something to keep them less agitated or to calm them down? But really at that point, there's so little that we can give them that will actually have an effect. And so we talk a lot about non-pharmacological interventions. So what are some things we can do as caregivers to keep that person calm? Because medications probably aren't going to work as the disease progresses. The two purple ones are treatments. And again, they only work in the very, very early stages. So if somebody is interested in a treatment, the earlier the better, or they may not qualify for those. And then Belsomra and Rexulti were just recently added. They are for insomnia and agitation, but again, only in the middle stages of the disease. Here are those 10 healthy brain habits that I talked about. And I think I got a call from somebody near Cut Bank. And she said, well, she said, my whole family got dementia, so I guess I'm going to get dementia too. So what do I need to do? And I said, oh, actually, there's a lot you can do. And I shared these with her because that feeling of hopelessness of, well, everybody else in my family has gotten it, I'll probably get, not Cut Bank, sorry, Culbertson, I'll probably get it too. I was like, and she said, I was hoping I could travel, but I guess I can't travel. I guess I'll just stay home. And I'm like, no, no, no. Like, here are some things you can do. And so also trying to give people a little bit of hope. Don't just throw up your hands and say, well, I'm probably going to get it. I might as well just sit at home. Get out, encourage them to get out and socialize, to do things, to stay active, to stay involved, because that's the best thing for the brain. This is a large study that's going on about the lifestyle. And I just like this slide because it shows that this is a worldwide problem. It's not just a problem in the United States, it's a worldwide problem. And the whole world is watching what's happening in this area right now. So there are ways to get involved. We do have volunteer opportunities. For example, if one of you or somebody in the Plentywood community, Sheridan County community wanted to become a volunteer, we can onboard you to become a volunteer educator. Then you have access to all of our education programs, all of the curriculums, the slideshows, and can provide that education at any time in any of your communities. I left this on from another slideshow, but for example, in the Flathead County, we have 3 volunteer educators up there. They go to senior centers, they go to churches, they, present at various locations around Kalispell and the surrounding area to bring education to those in that area. So I can always do them virtually, and I also have volunteers in Billings that are very good at virtual, so that's always an option. Or if one of you is interested, or somebody who might be interested, that's something we'd be more than happy to help with, to help set up. Advocacy, whoops. So these are all the education programs we can provide. Understanding Alzheimer's and Dementia, 10 warning signs, healthy living for your brain and body, dementia conversations. And then we just released one called the Empowered Caregiver. And I love this one because it's about giving caregivers their power back and letting them know they can be proactive, and there are tools and things they can do to kind of stay on top of their own stress and stay in front of the disease and not feel so reactive. That one has 5 modules. They're each about 45 minutes. They don't have to be done all at one time. They can be staggered out. The Managing Money one is very, very good, and it's for any caregiver, not just those with dementia. And then I'm always available to do about a 15 or 30-minute presentation on the latest research. These are brochures that we have available. We're kind of limited in our stock of brochures right now, but I still feel like our live education is better than a brochure. I think brochures can just be overwhelming sometimes for folks. We do have advocacy. I talked a little bit about that already, working with our state and national government. Trial Match. Well, that was when we met with our congressman last year. Trial Match, you can sign up for. It's free. It's a way to get into the pool for any research that's taking place right now. I signed up for it. I live outside of Helena. I'm not near a lab. So all of the research perspectives that I receive are brain surveys and brain health surveys. So they're not all invasive. Some of them are lifestyle, some of them are brain surveys. They're all very different. You can pick and choose which ones you want to be involved with, but it's a good way to feel like you're doing something and giving back to this. We have our Walk to End Alzheimer's. We have 6 in Montana, but what some of our smaller locations do, like Plentywood, is hold their own. So just have a little community walk. Butte is doing their own walk. They do it at one of the assisted livings there. It's just a fun way to bring people in the community together, to lift up those that are living with or caring for somebody with dementia, to bring more awareness about the disease, to do fundraising for it, for the efforts, the research efforts, and for education. So that's a good way to bring the community together in a positive way around our cause. This is pictures from the Flathead Walk last year. All the flowers represent something different. So that's why there's different colors of flowers. And then we have our longest day. We always say the day with the most light is the day we fight. And so we do activities too. There's activities all around the state, usually on that day. We also know that every day can feel like the longest day for caregivers. So we want to acknowledge what they're doing every day through our longest day activities. Sue Warren in Great Falls is one of our board members and one of our volunteers, and they light the historic 9th Street Bridge on the longest day in purple, since purple's our color. And it just brings awareness to the city and gets people talking about, why is the bridge purple? What's going on? And acknowledges and honors those living with the disease. So that's her fundraiser. Please feel free. I forgot to also mention we have a helpline, and I did call it a couple times with my mom, but they are available 24/7. It's staffed with master level clinicians, and they specialize in dementia, and they're amazing. One time I called and I think I just cried for 20 minutes before I could even talk. And in our rural areas, that's so important to know that we have access to that resource. So 800-272-3900. And anybody can call it. A first responder can call it. A nurse working in the ER can call it. I mean, anybody can call it. So